baseball season, you know, doctor, it's pretty long. It can go from late March to early November, and games are played often. There's about, I want to say, more than 160 games, 162 to be exact, played over the course of 6 months. That's a long time. And that doesn't include spring training or the postseason. So do you see a lot of injuries related to overuse or fatigue because of this kind of schedule? I mean, it's demanding.
No, definitely. I mean, baseball is very different when compared to other sports because baseball, I hate to say it's all overuse injuries because it's not. There's certainly traumatic injuries as well. But, you know, if you're playing football, there's a lot of collision, or soccer. You know, the World Cup's going on right now. A lot of collision, like things that happen, or even non-contact traumatic injuries. But baseball's a lot of overuse injuries, a lot of throwing too much or running too much or that kind of stuff.
Exactly. So let's start off by talking about the shoulder. That's where we really hear a lot about the injuries when it comes to baseball injuries and athletes as a whole, let's be honest. So we have a list of different types of joints that you can maybe run through this list, Ed and Gil. Let's take that for our viewers. And doctor, maybe walk us through it. This is, again, the shoulder. You see a lot of this. So which one does the shoulder joint fall under? Well,
I mean, the first one on the list, the shoulder is a ball and socket. You know, you basically, the speech that I give all of my patients is the shoulder is a golf ball that sits on a tee. And it's all the little muscles that help it move around, and that gives it the freedom that allows us to raise our arm above our head and throw a ball.
And then the hinge?
Yeah, I mean, the hinge joint, if you want to, the typical, I guess, example of that is the elbow.
Right.
Yeah. The knee is almost a mix between the pivot and the hinge, because there is a little bit of pivoting component that we don't talk about too much in elementary school, but there's a little bit of that makes it a little bit
and then
more.
the final one?
And then the ellipsoidal. Honestly, I don't talk too much about that with patients because they're usually small little joints that don't have much to do in terms of...
But where are they? Just educate us now.
So you can have them up here, your sternoclavicular joint, or maybe your AC joint's kind of similar to that too.